Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and if you're new to us, it's great to have you here. Welcome. We're really excited because we are having some just amazing conversations with real leaders that are painstakingly reshaping the future of health. And we're really focused and passionate about a few different areas. We're passionate about innovation, access, leadership, and innovation adoption. And if it's your first time tuning in, let me just kind of take a quick step back and tell you a little bit more about what we're trying to get done here. So our focus is bringing real stories of real leaders that are actually innovating and getting things done and giving them the opportunity and the space to be able to share their stories, share their wins, share their learnings with our community and ultimately with the world. If you haven't had the opportunity to check out any of our historical interviews, wherever you are, if you're watching this, if you're listening to this, however you're consuming it, please hit the subscribe button now so that any of the new interviews come directly to you. So today's guest is someone who really kind of carries a lot of depth that an experience that you can't fake. Sean O'Connor is a retired Navy officer and president co-founder of DexCare. But what makes Sean stand out, it's not necessarily his title, it's the way he shows up, it's how he understands how access is much, much deeper than most people ever really understand. It's not a buzzword, it's really a lifeline. And over the last several weeks, Sean's been on Capitol Hill talking with more than a dozen members of Congress about one thing. How can the VA modernize access to care, especially mental health? And that's not a small conversation. Anyone who's spent time in the veteran community knows how hard it is to navigate systems, schedules, providers, nonetheless geography. And this is even more magnified, especially in rural areas. And the reality is that we lose 18 veterans a day to suicide. Like that hits hard, especially with a number of my friends and some that I know that have unfortunately are part of that. That hits all of us. And what I appreciate about Sean is that he's coming at this from a place of service, from experience. So from building DexCare into a platform that helps people get to the right care without fighting the system every step of the way. And he sees the gaps, the waste, and the friction, and he's focused on, putting together solutions that make the existing system work better. So that's what today's conversation is going to be about. It's not just about innovation, it's about stewardship, it's about service and honoring the men and women who have served this country by building access that actually works for them. So Sean, it's great to see you. Welcome to the show.
Michael, I'm incredibly humbled by that introduction. Thank you for having me. It's a privilege to talk to you. I really appreciate all that you're doing and try to drive awareness around innovation and access to healthcare for those in most need. So I'm really looking forward to this conversation. Incredibly grateful for that introduction. You've got me blushing here
Yeah.
already, but happy to join.
Well, we recorded it, so you'll be able to use it, for your next time you kind of walk in. So feel free to use it. Now, listen, before we kind of dig in, when people hear retired Navy officer turned health tech founder, um, they don't always kind of connect those dots. What's maybe the story behind those two worlds and how they sort of shape the way that you see access and leadership today?
Yeah, I would say your point of kind of in the intro on service is kind of probably the foundation of all that. And a point of clarification, I'm separated from the Navy. I didn't do the full 20 years, but I had a career in the Navy that transitioned into the health
Yeah.
tech. I still have friends that are still active duty, that are getting ready to retire. But I think for me, from a foundation perspective on those bridges, a lot of it was just how I was raised, similar to you. Grew up in the Northeast. I'm third generation military. Both my grandfathers fought and served in World War II. My dad's father had a Purple Heart for being shot down in the Pacific during World War II. My father and uncles all served in the Vietnam era in the Navy and Marine Corps, and I'm a 9/11 Navy vet. So just the way I was raised over time, typical Irish immigrant family. Everyone came over and either a cop, fireman, military, and service, and
Right.
being there for others in need has just been kind of ingrained in our family from the beginning. A lot of great leadership lessons that kind of served from there to the foundation of the military, and then I got out of the military shortly after the 9/11. The op tempo was crazy high. I was on active duty when 9/11 happened, and we were pretty much gone for 2.5 years without coming home for anything more than a 4 month stint. So at that point in time, it was kind of time to transition out. I got drawn to healthcare through some personal experiences, maybe we'll talk about here later on, and then got in
Hmm.
the healthcare space and wanted to be in the innovation space at that time. So my first, and also I've basically done 3 companies since I spun out of, or since I came out of the military. All our venture-backed companies spun out of healthcare systems. The first was a
Yeah.
company out of Stanford that became Intuitive Surgical and the Da Vinci robot, and spent 10 years with them, and then spun a company out at University of Washington that was focused on helping surgeons improve surgical technique. And Johnson & Johnson bought that company, and then really became more enamored with the access issue around healthcare,
Mm.
towards this point in my career. And the Providence team was working on something, their digital innovation incubator is really trying to make it easier for patients to find and get to the right care venue at the right time for the right reason. And that's incredibly complex through what you brought
Yeah.
up there. But it was a worthy kind of personal mission for me and a really complicated problem with healthcare. So joined the Providence Incubator and wound up spinning DexCare out. It's really continuing every day to try to advance that um, access initiative for the most vulnerable and the most in need, to try to help them get to the care they need, when they need it, how they need it, and where they need it. And it's a very personal issue, and I think it's a very big issue broadly for our country as a whole.
Yeah. I'm just curious. I mean, you've been sitting with members of Congress and you've been talking about, modernizing the VA experience. How much of your time is spent, around, I'll just say, advocacy? And I think what's the one thing that, folks don't really fully understand about the VA care experience? I'm just curious, hearing it from someone that's, kind of inside the system.
Yeah, I'd say on the advocacy question, a pretty healthy portion of my time over the last 6 months as I've gotten more enamored with trying
Hmm.
to point our technology solution to helping those in need, i.e. the veteran community. You brought up suicide and mental health in the beginning. So when I transitioned from the military in 2005, it seems like it was just yesterday, but the VA received roughly $21 billion for their mission. And that same year, 17 men and women, brothers and sisters, friends, cousins, whatever, took their life every single day to suicide. Fast forward 20 years later, the VA received $121 billion to support its mission. And as you mentioned in the intro, that number hasn't changed. We've lost more men and women to suicide than we've lost in the 9/11 combat war and all the kind of subsequent battles in Afghanistan post 9/11, which is a tragedy that we don't talk about here nearly enough. I've lost classmates and friends that have taken their life due to this. So, as our technology stack has solved some really complex healthcare access issues for systems
Yeah,
like Providence
yeah,
and
yeah,
Kaiser and others, I started just to go to my board and team said, "Hey, I want to push this at the VA and see can we help, change that narrative." And mental health is a really complicated issue. It's not just a
yeah,
technology.
yeah,
A lot of
yeah,
that from people being homeless to not being registered in the VA and all that other stuff. But the experience I have right now in trying to get into an appointment in the Seattle VA is very complicated. It takes a long time, and it's very process and intensive, and it takes forever to even get something. And like basic online scheduling isn't even available to vets. So with that, I've been gracious enough to have good leadership around me and good investors around me that are also supportive of this mission. I've been given the time to go and go to meet the SVAC team and go to the Hill and start to understand, hey, how are you implementing the Dole Act? How can we help in some of these businesses that don't have basic online scheduling or don't have the ability or from a modernization or interoperability to share capacity and make access to veterans, whether it's within the VA or something called community care, easier. So we're spending a lot of time talking about these issues to say, hey, there's smart technology folks out there. We're just one of them that want to help advance this cause and just do whatever we can to help, move this needle because the number one thing to me that drives
yeah,
me that when people don't get access to care when and where they need it, the end result most catastrophically is that number you said in the beginning where people just don't feel there's hope. And that when there's no hope and they lose
yeah,
hope and give up, like that's just a tragedy for us to be going into 2026 and over 2 decades, that number hasn't moved. We got to do better, man. Like that
yeah.
community deserves better.
18 veterans lost per day. Like, that's not data. Like, those are people.
People.
Those are people. And it just sounds as though that, that has really sort of shaped the way that you approach your work now. And I mentioned earlier about how access issues hit harder in rural areas. I remember going to a Sanford Health Rural Summit. And at the time, I believe it was the head of the VA was chatting and he was giving some statistics, and I don't have them pulled in front of me, but just talking about how the number of folks that are in rural areas that are veteran, it's like a big number. I guess, is there a moment or an experience that made that particular challenge like very crystal clear for you? Anything you can share on that, I think would be great.
Yeah, it's a challenge. I think a lot of folks when they come back, they want to get off the grid and kind of go in some of these areas to decompress. And so there is a large population of folks that go to Montana, Alaska, and some of these areas where
Yeah,
veteran community is very strong. And getting access to timely care in some of those places, to your point, is really difficult to do for a lot of reasons. So we've been spending more time trying to highlight some of that in addition to some of the issues around homelessness and people not engaging and not and the stigmatism around raising your hand to help when you ask when you need care.
yeah,
Uh, but not opening up the funnel for people to get in through some, virtual technologies, digital technologies. We're in the digital age of healthcare, so these
yeah,
solutions need to, more broadly educated and pushed out there to try to engage some of these folks that don't have the ability to drive 15 minutes to a clinic when you're in Eastern Alaska, it's, maybe 8 hours to get to a clinic. And
yeah.
so if we don't open up some of those avenues, some of this stuff, these issues start to exacerbate themselves over time. And that's a extremely vulnerable population when it comes to this, and a difficult to engage population as well for a number of factors.
Just sort of thinking back to your military training career, you've done, I'll call it three professional tours of duty, as you kind of alluded to. I'm just sort of curious, what part of the military culture kind of sticks around with you as you try to infuse that into DexCare that sort of helps thrive while you're in health tech? And what part of that military culture? Curious if you had to unlearn any of it as you've been in your professional tours of duty.
My wife says I still need to unlearn some of it when we start bossing people around the house on laundry. Yeah. But I'll answer the
And
good part.
that's an order. And that's an order.
It's not an order. I've learned who the real chain of command is in the house. On the stuff that has stuck, I think it's, you develop this sense where something taught early in the Navy career. It's called the fifth law of the Navy. It says, on the strength of one link in the cable dependeth the might of the chain. Who knows when that may be tested, so live that to beareth the strain. Which essentially, like, your team is only as strong as your weakest link, and you never want to be the weakest link to let the team down. So in terms of
Mhm.
the lessons that have pulled forward, it's always about how do you show up, how are you prepared, do what you say you're going to do, empower your people to do good things, and then never never be the weak link in the chain that lets everyone else down so you can continue to grow, right? So I think there's a ton of I've had a lot of great mentors in the military, a lot of great operators in the military that have helped shape my career, but the fundamental things have always been take care of your people, listen to your people, and do what you say you're going to do, and do it when you say you're going to do it. And if you do those things, it sounds cliche, but every company I've been at, if we've done those things, you kind of build a good company, you build a good culture, and you kind of figure things out because the people know that their voice is respected, their opinion matters. We're listening on this together. We're all trying to solve this problem together. We're all working hard and rowing at the same time. No one's doing this. And when you have those things, you have good people, you have a good mission, you're trying to solve a good problem, you
Yeah.
tend to kind of figure it out, even in environments that are as hard as healthcare.
Yeah. I mean, you've done this now your third time here. I'm just sort of curious, like take me back to maybe the early days of DexCare, because there's some that are listening here that are maybe earlier in their entrepreneurial journey. When you guys were kind of back inside of Providence, I guess what was that spark? Do you remember when there was a moment when it went from, hey, this is kind of an interesting idea to, hey, we need to do this, like we need to build this.
Yeah, maybe I'll tell like a quick personal story of like why I wanted to do this over everything else.
Yeah,
Know this.
yeah.
I was just telling this. I was trying to get too emotional here. I just told this story to for the first time at a company meeting recently. But my my daughter's in middle school now, and she had an assignment this year that was, hey, go interview some people on 9/11 and just ask them what happened and what they remember about that day. And it's funny, like the kids in these classes, like, some didn't even know what 9/11 was.
Some people don't even know. Isn't that crazy? I knew I was old. I was talking to someone a couple weeks ago, and I was saying, well, what were you on 9/11? They're like, I was like 6 months old. I don't remember it. And I was like, oh my God, I'm old.
Yeah, I've had the same realization. So I was like, oh, baby girl, that's a really important day for our family. So I told the story. I was on active duty that day. I was on a carrier out in San Diego, and we were actually doing qualifying mission or something called carrier qualifications, which is basically the air wing practices and landing, taking off on the carrier before you go on deployment. So we were off the coast of San Diego doing that, and we were close enough within shore where the closed circuit TV picked up the local news station, and we just got done with breakfast and saw the first plane hit the tower. And it was, being a northeaster, it was like, holy cow, like what's going on? It's like someone fly a private plane in the tower, and then shortly after the second one hit, and then the ship went to general quarters. And we launched all our aircraft and shut down all communication on the ship. And we did something called combat air patrol, where all the aircraft were going up and down the West Coast, and they were giving the orders, if the commercial airlines don't engage and respond, you shoot them down out of the sky, which is a total surreal moment. And I had a bunch of buddies that were pilots that day and telling stories around just, dude, they're like flying and the kids are waving on the plane, and they're like been told if they don't respond, you shoot down the plane. And so it was a crazy day. We were out to sea for about 10 days, and then we came back on a Sunday. And I remember it was the Sunday when the NFL restarted and everyone's kind of run out the flag. And I just got home and kind of collapsed, and like they let the surrealness of the moment hit me. And I hadn't been able to talk to my family at all, obviously, since that day, because the ship was shut down from a communication
Yeah.
standpoint, running around. So I call home just to talk to my parents and told my mom, hey, everything's okay. We're safe, but things are going to happen here. We're going to be gone here pretty quickly. And I think, where we're going, that whole kind of deal. I said, hey, can I talk to dad? And she's like, well, I haven't heard from your father in 5 days. Like, what do you mean? Where's Pop? Well, my dad was a Port Authority police officer in Newark. And he had fortunately retired when I went to the Naval Academy because we didn't have to pay for college. But when 9/11 happened, 23 of the men and women he served with were killed when the second tower came down. So he went back to work ground zero and spent several weeks working ground zero, pulling bodies out of there. And his job was to notify next of kin when they found the mother or father or whoever it was for any police officers or Port Authority folks that were at ground zero. And none of those guys worried about protective gear or, wearing masks or any of that stuff as they're breathing all stuff in. So post 9/11, he was one of the fortunate enough ones to make it, but he's had 18 9/11 related illnesses since. Luckily, he's still with us, but he's been in and out of hospitals for 18 years. And that's a huge strain on the family for a lot of reasons, as you can imagine, both from a PTSD perspective.
Yeah,
I
man.
we talked about that day once, and just from a healthcare perspective and how you navigate some of the stuff and all the clinical care gaps. So after struggling with him over the last 10 years of trying to get him into appointments, figure out where he needs to go, how does he get healthcare access? How come these doctors aren't talking to each other? How come the records aren't passing over? Why is it so hard to get him into an appointment? When
Right.
the team came and said, hey, we're working on this thing, it's around making access to care easier for consumers, sign me up. Like I'm all about this.
Yeah.
Like we struggled through this with my father and all the other, friends and family members that have been going through some of these really complicated related illnesses. So it's not a pie in the sky, like, hey, we're going to solve the cure for cancer kind of thing. I knew like access is not a single silver bullet.
Yeah. Yeah.
But if it
Yeah.
was an opportunity to focus on this and help people like that, and just seeing the pain that families go through when you can't get access to care, you don't know where to go, you don't know how to get there, it takes too long. Anything we can do to improve that is important, whether it's that community. I've been fortunate enough now to have the time to point that at the VA community, but that was what drove me to want to do this. So when we get into Providence, Providence was a large healthcare system that had a lot of complicated data sets and a lot of different EMRs, and just the data not talking
Yeah.
to each other. And poor data in is poor data out. And you need good data to make the right patient go to the right provider at the right time. So we spent a bunch of time kind of building it out. And Providence has a pretty big brand. So one of the things I hear you talk about a lot, Michael, is trust. And for me, like there's a trust factor there. If the health system sees a big enough problem to spend $30 million dollars of their own money in several years building this out to develop trust of like, how do we get a patient to the right provider, and trust for the
Yeah.
providers to know the system's working to put the right patient on my schedule. Like that was a big deal that there was a signal there that there's a trust factor there, and it's being built within a health system for health system providers. And then as we started to deploy it within the beta sites within Providence, we saw that it was working. It was capturing people that were searching for care, getting them in quicker, getting them into the right care venue. And we just saw more of a need for patients to want to have the option to shop for care
Right.
online, find stuff online where I don't have to log into a MyChart account. I don't have to go through an authenticated user. I just need
Yeah.
to see what's
Yeah.
available and figure out what's best for me. So as we started to see that roll out, I became more energized about it. We got our first venture team to be energized about it. And then we started to see signal from Kaiser and some of his large health systems say, hey, we have these problems where we can't share capacity across our health system because of these data silos. And if you guys can help break that down and manage supply and demand real time a little more efficiently, that's going to help us a lot. So that was kind of where the light bulb, your question, light bulb clicked. That was
Yeah.
where
Was that the aha moment when you realized that the systems didn't necessarily have a patient access issue? It was really more of like a capacity orchestration issue.
that was part of it for sure. Yeah. And just how we showed up on the front end, how we orchestrated care in the middle, and how we got people to trust it. Like those are the three kind of aha moments. And we had a lot of great people within the Providence leadership team that helped figure that out. A lot of
Right.
great people. We were just kind of the engine to help figure out how do we scale this thing beyond Providence. But those were the main aha moments. And it's not easy, as you know, like healthcare access isn't easy for a lot of different reasons, but we saw enough kind of momentum in some of those areas where it was making sense, and it just gave us kind of one more thing to stack on there to try to figure out how to do the next challenge and the next challenge and the next challenge.
Well, I mean, talk about access. I mean, I guess what's a myth about access that you wish we would actually finally retire?
Oof. Like from a just like a scheduling standpoint.
Yeah, I mean, there's just a lot of myths that people think about access when it comes to that. I mean, are there any that you're just like, oh man, I wish we could just kind of debunk that and let people know that like it's actually really not that.
I don't know if I can come up with one. I think the thing that um, we continue to try to improve and struggle with. I don't know if it's a myth, but it's just the trust factor of access, I think is a big deal, right?
Yeah,
From as you go up in level acuity from same day to primary to specialty care, those resources become more constrained in the health system. They're expensive, they're limited, and I can't have Michael taking up an ortho appointment if he doesn't need to go to an ortho, he just needs to go to
yeah.
PT. So I think the thing that we're trying to debunk on there is, maybe it's the myth of like the providers feel like there always has to be a phone call with somebody to ask the questions because they're just not going to get it right. And you know this as well as I do. There's a bunch of tools that have evolved from AI, agentic AI, where if you feed the system the right data, it can make a decision on behalf of a human to put the right person on the schedule and take some of that lift away. It may never take away 100%, but today it's a good majority of stuff going to a call center or someone calling the front office at the clinic can be handled, better
Mm,
through the data engines that exist out there, whether it's not necessarily a promotion of DexCare, but it's us or somebody else. Like there's that is an issue I think where um, the timing of how much AI has evolved in the last 18 months is ripe for
yeah.
disruption when it comes to making access more scalable and more reproducible. So now we have, even in the call center for a day or for 40 years, you can have the same data set you're working off of to book an appointment because everything's fed into a data engine that updates itself every day versus every 2 years for some of these decision trees, which should lead to greater confidence in scheduling, which should lead to hopefully greater confidence and trust, which should lead to people opening up more schedules so you can truly see access. I think to that maybe the long direct roundabout questions people say if we don't have capacity is the constraint on
Mm,
access. We find there is capacity.
there
The
is.
real constraint is not capacity. It's the lack of trust to open up that capacity from some of these groups, which I totally understand.
Mm,
It's like someone going to say, Michael, give me your schedule. And, like, why would I give you my schedule? I don't know who you
yeah.
are. I don't know what you're going to put in there. I don't know. You don't know how to value my time, right? So we totally understand some of that perception out there, but there's enough uh, data engines that have been built up that can make this work a lot more efficiently.
Well, talk. You mentioned about like, hey, look, maybe DexCare isn't the right, sort of partner. Can you talk about maybe collaboration with other innovative companies? Do you feel like you're at a large enough scale where you can actually have folks kind of playing within your ecosystem? Maybe talk about how well you can kind of play within the sandbox. I feel like there's this notion that sometimes there might not necessarily be more than enough room for one in a chariot. Where like, do you view that differently? What's your sort of take on that?
I do. I think these problems are are too complicated to try to go out and figure out you're going to do it all on your own. So I think just from a starting standpoint, we work very collaboratively with the data sets that exist today. So we're not an EHR vendor. So whatever source of truth is for a lot of the patient scheduling and provider data, we have to find a way to integrate into that. And then there's tons of opportunities to build experiences on top of that, right? We work with virtual care companies to provide a virtual outlet for some of this stuff. We work
Mm.
scheduling companies to help with some of the scheduling infrastructure we're doing. We build some of our own. So we've always had an avenue of it's going to take a village to raise this kid, and access in this country is still very complicated. There's a reason why less than 10% of stuff is scheduled online, even as we go into 2026 across some of these major healthcare systems. It's a really complicated problem with a lot of disparate data, a lot of infrastructure that goes into that, and a lot of trust that's been eroded on just poor
Mm.
experience asked from these provider groups. So to overcome that, yeah, it does take, more than just one bright idea. It takes people willing to talk, have conversations, and try to advance and do what's best for the patient at the end of the day. Right. And that's been a lot of
Yeah.
our mission with the VA. It's like whether you choose to use us or not, all we're trying to do is advance making it easier for veterans to schedule an appointment. And we're happy to share what we built, how we built it. We'll share that with you. We'll share what other folks have done in this space. We're just trying to push kind of how we innovate and collaborate together. And some people are super skeptical of that, and some people are receptive of that. It just depends on, who
And
you're
what
talking.
I like the ones that are skeptical, like what's the biggest tension when you're talking about modernizing this experience?
Vendor fatigue, uh, the not built here syndrome, so therefore can't trust it, and just too much other crap on my plate where this sounds nice, but just my day to day is so overwhelming that I don't have the time to build these things because all I'm doing is putting out fires and then my IT team is cut, my infrastructure is cut, and as much as I'd like to innovate, just keeping the lights on here is taking up 90% of my
Mm.
time, which I understand.
So let's just say, as you've said, look, the VA has the resources. They just need better coordination. What does better coordination actually look like? For a veteran, let's just say that lives 2 hours away from the nearest clinic. Like, give me an example of DexCare in motion. What does that look like for a veteran?
Yeah, and when I say they have the resources, this is coming from our conversations with vision leaders, right? And
Yeah.
this isn't a bash on, I'll be clear, like of the VA caregivers. I've worked with them for a long time. As mentioned, my third generation veteran, like they're some of the most mission-driven people out there, right? They can make more money in the private sector, but they choose to stay delivering care to veterans because they believe in the mission and they want to service the men and women that are there, but they don't necessarily have the tools to do their job most efficiently. And the tragic part of this is I think the VA was maybe the second health system to
Right.
adopt an EHR behind the Mayo Clinic, but it really hasn't evolved since then. They have their own instance on something called Vista, and there's anywhere between 120 and 150 different Vista instances, depending on who you talk to. And those things are just they're a good uh, kind of clinical tool to kind of treat kind of patient dynamics, but they lack a lot of interoperability and ability to easily extract data across those instances. So you look at we have the largest health system in the country serving 9 million veterans with 120 plus different instances and now converting over to Oracle that doesn't talk and doesn't communicate and doesn't share best practices or availability, right? So when just one VA hospital we're talking to in one visit, they feel that they estimate it's about 10,000 appointments that go unutilized in their hospital every month because of the lack of connection
10,000 every month?
every month. So at the same time, this
Wow.
thing called community care program is growing, which me as a veteran I appreciate. It gives me the option to go to the most convenient care option for me when I meet a certain criteria, whether it's in the VA or outside the VA. But their community care program has gone up about $500 million in cost in 4 years, and it's taking 4 times as long to get into a visit. So it's not necessarily
Wow.
making it easier and faster for me to get in. And then meanwhile, the same VA hospital has 10,000 of their own internal appointments that don't get utilized. So, so what it looks like for us in motion is finding a way to break down those silos like we've done for other systems and truly have a pool of availability that has a rules engine associated with it. So Michael's coming in with I'm returning from deployment and I had a PTSD call, or this is my annual primary care visit. We can
Mhm.
surface the right option for the veteran based on the routing logic that exists for when someone should stay in the VA versus one who needs a referral to go to community care. But there's enough there where you can put that in a rules engine and surface in one single pane of view glass online the ability to find and book care, whether it's inside or outside the VA. Today, for me as a veteran in Vision 20, it's 18 clicks once I log in to get to calendar. Calendar doesn't show me any availability. It just says pick three options, morning or afternoon, and within 24 to 48 hours, an MSA agent will call you back and schedule your appointment. So I pick three options, doesn't tell me if those are good options or bad options or if there's an
Right.
availability. And then I literally just wait for someone to call me. And then you know how it is. I'll be on the podcast with Michael and they'll call, you can't pick up, and then you're playing phone versus
Okay.
any other healthcare sector or any other private sector outside of healthcare. I just go online. Here's my conditions. Here's what I'm looking for. Here's my insurance, and here's my availability, and I'm done. But our largest health system in our country, that's not the experience at scale. And there's pockets of the VA. The VA has almost 24 different scheduling solutions. So there's some that have built their own homegrown solutions or their own local solutions that work better. But at scale, it's different across board for most vets.
So it's like you've gone to one VA, there's one process. You go to another VA in a different part of the country, it's an entirely different process. So from a standardization standpoint, you're saying that
Doesn't
it's not
exist.
standardized, doesn't exist.
Yeah. Yeah. The funny thing is like the routing logic and the rules for who should stay in versus who should go out in the community are
Yeah.
standardized. The actual process for how Sean wants to schedule in Seattle versus how Michael wants to schedule in Chicago are totally different.
Yeah, and honestly, with newer generations, veterans that are, I'll just say they're not necessarily tech savvy, rather they're tech dependent. They grew up with a smartphone. Maybe they don't want to talk to a human. Like they just want to do it online. They just want to text someone or what have you. So to actually knowing that there might be some parts of the VA that have that capability and others that don't, it's got to be frustrating as all heck.
Yeah, and we've heard this from, you mentioned some of the advocacy work we're doing on the Hill and with VA leaders. One of the stats we heard from a VA leader we talked to recently is 70% of veterans prefer virtual care and online options, right? So to your point, whether it's the younger community or just the ease of access because they're in rural spaces, giving them that option is important to engage in a virtual visit, engage in virtual care, schedule stuff virtually versus having to always call. And then there's also the portion of, the other big reason as I get older and become more nostalgic. Like when I first got out of the Navy, it's a tough transition to go from, being in the
Yeah.
military, high operation tempo, you're deploying, you're going to war, all this stuff. Like what of that is transferable to like anything in the private sector. And you go through the struggle of trying to figure that out. And then I moved to Seattle. I didn't know anybody up here. I'll just go to the VA and sit in the damn lobby and just, shoot the, what, with guys that had the hats on in the Vietnam era, World War II,
Yeah.
and people tell stories. It's like an institutional fabric. So there will always be a part of the community there. That's why I think it's such a precious institution to protect is, it's a very unique care ecosystem where that subject matter expertise of being a veteran, having that community is super important to their recovery, whether it's physical or mental as they go on. So I think that that physical presence is still super important. And you have to engage the younger demographic or people with different preferences that need things more digitally, do things virtually just because they can get in easier. Because, I gave up on trying to continue to
Right.
schedule there because it's so hard. There's just easier options for me to find in the private sector.
That's really like you have choice. Others don't have choice, and they end up having to just like deal with it. And then what happens is if it gets too hard, they
And,
just they just
and
stop trying.
that's why that number hasn't changed in 20 years, right? And that's the other big reason why it's so important to me now is I recognize the privilege I have of being in the healthcare space and working with great people and meeting great people like you over time. Like I know how to advocate for myself to get to where I need to go. Majority of the US
Yeah,
population, they don't know. Like we're back to my dad, like my dad would just sit there crying, like, I don't know what to do. Like no one's calling me back, right? And if we didn't have to push and advocate for him and just know that, like it shouldn't be that hard for people, right? And these
yeah,
are one
yeah.
of like many horror stories you
One of
hear.
many, one of many, one of many. So how do folks kind of engage with DexCare? Maybe kind of tell people a little bit more about where they can find more about the work that you guys are doing. Yeah, just spend a little bit of time doing that. Just want to make sure we do that before we forget.
Yeah, folks can engage at our website, dexterhealth.com, or LinkedIn page, or Instagram page, or social page. Anyone that wants to react and have a conversation, we're happy to have a conversation. And then we're always at some of the major trade shows as well. We're talking before the recording turned on about Vive and some of these other meetings. We have a presence at all those where people can find us. And happy to chat about any of this stuff as time goes on. I think you're pointing a really important light at a really important issue is how do we just, help continue to advance, giving people access to things that are going to make their lives healthier, make their lives easier, and whatever small part DexCare plays in that. Our team is very mission driven to try to do that for communities like the VA or the veteran community, plus whoever else needs access to care, regardless of your, prior record of service or not.
In addition to the sort of the technological advancement component, is there a service component that you guys can deliver if to maybe fill some of those needs if need be?
There always is, yes. That's a big piece of it is just getting the plumbing and the connection set up to be able to enable the experience is a big part
Yeah,
of it. The ongoing service and support is a big part of this, which we provide those services. And then I think the other unique thing I think about this company versus the other two I've been fortunate to be a part of is because we came out of a healthcare system and had,
yeah,
the of healthcare executives plus providers all day long telling us, hey, you digital nerds, don't do this. No one will ever do that. We have a different point of view on like how you get the physician community to adopt and embrace some of the stuff and a
yeah.
first seat point of view of like how hard their lives are when you screw up their schedules. So I think in addition to the service and support we put around it, we bring a more innate understanding, given our origin story, spending 3 years in a healthcare system building this out of how do you need to talk to folks and understand what's Michael really saying to build the right
Yeah.
solution versus, a lot of kind of tech innovation for tech innovation, but no context of like how crazy my day is in clinic. And if you screw that up, I'm gonna, off with your head kind of thing.
So it sounds like that's part of your core story when you're reaching out and you're speaking to new people. You let them know that, hey, we're one of you. We're a peer. And do you feel like that actually is what kind of diffuses and brings some of the people's defenses down as a result of that? Just knowing that you came out of a health system, you understand the nomenclature, you understand the chaos that they're dealing with.
I think so, especially early on. I think that's changed. You've probably seen this change just as much as I. Like we're
Yeah.
going back, started this literally my co-founder and Derek started this we came into Providence like 2 weeks before the pandemic hit in 2020. And at that point in time, a lot of healthcare systems had digital innovation groups, investment groups, and it was kind of the,
Mhm.
the early adoption of kind of influx
Yeah.
of digital health. You look at the last 5 years, I think that model has changed quite a bit in healthcare. A lot of those digital innovation health shops and health systems have shut down. They're kind of sticking to their core competency. They realize how hard it is to innovate and spin out and grow
Yeah.
as a company. So that network effect has definitely changed over the last 5 years. Where early on, everyone had a digital team. It seemed like everyone had a venture team. Everyone was kind of collaborating and sharing ideas. We would go there, they would come here, and this was a really
Yeah.
cool time. That's changed a lot. We don't see that as much in 5 years, but to your original question, I still think it helps. It doesn't change the DNA of who we are and where we came from and
Right.
but the environment is also very different today than it was in 2019, 2020.
Yeah. All right. Let's do some rapid fire, a fun way to end this. Maybe what's like a leadership trait or habit that you picked up in the Navy that you still use every day?
uh early to rise, early to grind. So I still get up at, oh dark 30, still make sure I get my workout in every morning and get a head start. I tend to get in 2 hours of work before most people turn on the laptop. So that compensates for I may not be as smart as everybody else, but I'm going to grind harder than anybody else. So whether it's military, or New Jersey, New York, and yeah, that's has
Yeah.
started all these years, and it will
Uh,
continue.
what about maybe best piece of advice that you've ever received and who gave it to you
Oof. Military or just in general?
in general?
Um, Well, I kind of feel like if I don't quote my dad, I'll hear about it. Um, so my dad and I used to go fishing when I was a kid. Like every Saturday, we'd go down the Jersey Shore and just go fishing. And he'd always get upset because he'd invite one of his cop buddies, and they'd always be late. And he's just early on started pontificating on the three lessons in life you need to remember. And it was if you tell someone you're going to do something, you do it, no matter what. Your only excuse is you're dead. If you're not on time, you're wasting other people's time, which is their most precious resource, and don't ever be disrespectful. You be on time to everything, regardless of whether you're senior or junior. You show up on time, and you be present. And his third one was never piss into the wind, which was appropriate when you're on a boat and there's wind blowing and you. So I don't know about the third, how useful the third one is, but the first two I've kept with me
I,
of
I
uh,
I'd say they're
I'm
all
going to do
useful.
something, you do it, and I, regardless of the day, like I still get anxiety if I'm like a minute late to something. Like I just feel we don't know how much time we have on this earth. It's the one thing that's equivalent, and none of us can buy more of it, no matter how rich or poor you are. And if you're disrespectful of someone's time, you're just being disrespectful of them. And I just have a very low tolerance level for that.
Hmm. What about maybe favorite place you've ever been stationed or deployed?
Favorite place stationed was a place called Diego Garcia. It was a tiny atoll in the middle of nowhere, about 950 miles south of India. It was a quarter mile wide and 33 miles long, tip to tip. And I spent a year there, which was at a 22-year-old kid, which was really interesting. We're doing all the It was kind of the last stop between uh, there in the Middle East for all the kind of the stuff that was going on in the Middle East, which was
Mhm.
really cool. And then favorite place. It was a crazy time, but when 9/11 happened, after I got off the carrier, I was fortunate enough to work with a group called Special Boat Team 12. And they were doing all the insert extract missions for the SEAL teams that were going all over Southeast Asia trying to hunt down the bad guys.
Mhm.
And we got to go to, the Philippines, Malaysia, Brunei, Thailand, Singapore, and just kind of work with those teams on some counterterrorism efforts. And through that process, all those countries were really, really beautiful. We some spots in the Philippines that were really remarkable from a people, culture, and just a beauty perspective, and was very fortunate to be able to see some of the world, as the old saying goes, join the Navy, see the world. At least for me, that was true. I saw a lot of cool places.
Amazing. All right. And if DexCare had a theme song, what would it be?
Oh, geez. Depends on what day you ask me, but I'll probably throw out the first thing that came to mind, rapid fire, was the Rocky theme song. So
Yeah.
kind of
Okay.
getting up and going at it every day, and underdog story, trying to make it in the world, and take down some big issues.
All right. So my last question is just, I guess when you think about the future of access, the technology, as well as the people and how it's supposed to serve, I guess, what really gives you the most hope right now?
Um, how sophisticated and strong some of the technology sets are becoming with some of the advancements in AI. Like I feel like AI is thrown out a lot as like, hey, it's
Yeah.
this buzzword and people don't really know what it is. But we're in Seattle, so we're very fortunate enough to work with a lot of smart AI folks. And
Hmm.
the stuff that they're able to build and how quickly they can iterate and grow on some of this stuff is really mind-boggling. Like our build cycles over the last 6 months have been faster than anything we've done in the last 5 years. And learning how to use
Incredible.
tools, where to use those tools, it's been really impressive from a speed of innovation standpoint. So I think that's what gives me the most hope. And then the concern on that is just, how quickly we can get the culture of care to adopt that. And then the overall collective responsibility for health systems and vendors and all that to make sure that we do it responsibly. And we protect the right things that need to be protected. We protect the data that needs to be protected. And we pointed at doing some really cool, interesting, and good problems. I think that's the
Yeah.
responsibility beholden to all of us. But what gives me the most hope is there's a lot of complexity here. I think I heard a stat the other day, like healthcare data doubles every 46 days. And if that data is fragmented,
That's
you
crazy.
can't do the right things, right? So unless we start embracing some of these tools and how much AI has advanced in the last, call it 12 months, it's showing we can keep up with some of the complexity of how quickly this data is growing. And then we just got to make sure we do it responsibly, which I know there's a lot
Mm.
of people skeptical about that, but outside of that, like I don't see how we advance some of these issues. Like you look at we started the conversation on the VA. It's the largest healthcare system in the country. Um, and I can't schedule an appointment online there today, right? And the one thing you hear is from them is it's the most complicated back end ecosystem ever. Well, if it's that complicated, unless we start deploying some of these tech tools to help us scale, how are we ever going to fix the complication? So that's what I'm probably most excited about.
Yeah.
And always be that clash of culture and tech, but I think
And
it's
some,
there.
yeah, yeah. I mean, the enemy of complexity is simplicity. And in this case, it's like sometimes you gotta, if it's overbuilt in the wrong direction, it's like, what do? You simplify. Anyway,
Yeah.
Sean, it's thank you for just showing up the way that you did today. Um, you're rigorously honest, very clear. The stories were very grounded. I'm just wondering how your team reacted to the story that you shared earlier, about 9/11. And yeah, it matters. It showcases that you're human, that you care. And for, you know, someone who's listening right now, I mean, I hope you caught that. I hope you caught that. Access, it's not just a technology conversation. It's a people conversation. It's a reminder that, systems, you know, we build them to honor someone's life. And sometimes it can make it harder for someone, and other times, ideally, in a perfect world, it would make it simpler for them. We talk a lot about today, about veterans today, and man, these are real people, real families, real moments when either the system works or it doesn't. So just leaders like you that are actually trying to make a difference, it's important to amplify your story, the voice. So if you're listening to this, if this conversation moved you, challenged you, or made you think differently, or maybe there's something you can add, share the episode. And if there's a topic maybe that you want us to explore, or a leader that you want us to speak to, then drop a note, share a comment. I do read them. This is a platform that is about community. It's an interactive community. It's not just content. So thank you for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.
Thank you, Michael.